Influence Continuum. This is a podcast all about influence, not just destructive influence like the ones we see in cults, but also the ethical, healthy side of influence. Hello, I'm Dr. Stephen Hassan with another episode of the Influence Continuum. And a lot of people ask me, why do you call it the Influence Continuum, Steve? Why don't you call it the bite model? And I basically say my influence continuum talks about influence from ethical influence to unethical influence. And my desire for this podcast is not just to talk about destructive cults and abusive relationships, but also to offer my listeners positive things. So we had one on gratefulness, who was actually a cancer survivor who was terminal, who got better with the help of Western medicine and lots of spiritual practice. We did one on parenting, positive parenting techniques. And when I met Dr. Jeffrey Rediger, author of this really wonderful book, which I've recently read, Cured, Strengthen Your Immune System and Heal Your Life. This is a book I'm really interested in, so I read it, and Jeffrey and I have actually met and talked at length. So I'm just going to, if you don't mind, Jeff, I'm going to give you give the listener some laudatories. So you're a psychiatrist, you're board certified. You also not only an MD, but you also have a Master's of Divinity from Princeton, which is very interesting. I'd love to get into your interest in spirituality as well. You've been the medical director at McLean's Southeast Adult Psychiatry and Community Affairs at McLean Hospital. And you've been researching for your book remarkable individuals who've recovered from incurable illnesses. And you've been in the media, you've been on Oprah and a lot of other shows. You've been nominated for the National Bravewell Leadership Award. You've received numerous other awards for leadership and patient care. And honestly, you are, in my mind, a hero because you're from the medical establishment and you take the position the medical system is broken. Like there's fundamental problems, and I think my listeners all would agree. So with that, I'm pitching you a softball wherever you would like to start. Dr. Jeffrey Rediger, thanks for coming on.
Well, it's true that I'm all for science, and I believe that our medical system does do some brilliant things at times, but it's too often the unfortunate experience that people experience just how broken our system is. There's lots of people who don't get what they need, both in the medical and the psychiatric aspects of care. And I just, my heart goes out for all the people who are struggling with a heavy burden of illness and questions, and too often have trouble finding answers that really work and that genuinely promote well-being or healing.
Yeah, and you rightly point out how we've gotten so specialized within the medical field. Yeah. But nobody's paying attention to the person, the whole person, and their emotional needs, their family situation, their work situation, and other things. And psychiatry, because I'm friends with a whole bunch of psychiatrists, and they're all frustrated that the healthcare system pays for such little time that unless someone has the ability to spend more time with people are not getting that level of care that really could help them get better.
Yeah, it's a big problem. We have fallen into the situation where we study body parts, and that's what you do in residency, and that's how everything's organized. But I can't tell you how often I've been in the hospital taking care of a patient, and every specialist will come in and take care of their particular body part. But, for example, nobody's paying attention to the fact that the person isn't eating, or is depressed, or that they've lost their will to live, or that they're just so frustrated and feeling like their needs as a human being have been missed, or that the stresses that drove them into this illness are unaddressed or not even being asked about.
Right, exactly. And too often medication is prescribed, and not just from psychiatrists, but even from primary care physicians. There's record levels, if I understand correctly, of depression, anxiety, and suicidality culturally in the U.S. Can you comment on that?
Well, yeah, it's true. Especially since the pandemic, the rates of anxiety and depression and isolation and suicidality and substance abuse, these things have skyrocketed during the pandemic. And I receive printouts multiple times per day for all the patients we have in our emergency rooms in the Mass General Brigham system. And it's just tragic that we have so many people, and often young people, sitting in the emergency room for days and weeks and even over a month at a time, sometimes waiting for beds that don't exist. Sometimes they end up in the emergency room because they've spent months trying to find an outpatient treater, but can't find anybody because there's such a massive shortage. And so it's problem upon problem and layer upon layer. And
yeah, and a lot of us mental health people are burned out. I talk to so many of my peers, and we've been, working on fumes, and we haven't been doing the self-care we need to be there completely for our clients. And we need to talk to a therapist who can tell us, you need a vacation, or like cut back on your hours, because you owe it to yourself and your clients and your patients.
You're right. The system is overburdened in that level too. The treaters, the people who are trying to take care of patients, are overwhelmed because the demand is so high, and many are doing as much as they can, but the level of burnout, the staff shortages and programs that are causing people to see more than they can easily see. So many nurses, for example, and other health professionals are leaving the field because of burnout or moral injury. So it's just a crisis of unprecedented proportion.
Right. So I did promise at the beginning of this we would be on the hopeful, ethical side of things. But I think we owe it to reality to name, the situation we're in. But I would love for you to share how you got interested in this topic of studying spontaneous remission. And if I remember correctly, one of the things that started you questioning was about a doctor I think a neuroscientist. Tell us the story, please.
Yeah, so there's different ways I can walk into this story.
You choose any way you want.
Right. So the story started young, actually. I came out of my father grew up in the Amish tradition in northern Indiana, and we left the Amish tradition or area outwardly when I was 2 years old, but my parents left outwardly more than inwardly. And so I grew up with a lot of suspicion about the world in general. The Bible was thought to be sufficient for all knowledge. That directly placed me in contradiction with learning things like math and social studies and other subjects in school. And so from an early age, I began questioning how do you reconcile worldviews that are not compatible? And that made me a challenging child to raise, I think. It was also a very violent home with a lot of trauma and I think repressed emotion. Religion was very heavy and legalistic and rationalized a lot of the violence. So it was very difficult. I rebelled and went to college and continued pursuing these questions about worldviews and how do you know what's true. And then from there, continued to question, went into seminary at Princeton and went deep into theology and philosophy of science. And that convinced me that science is actually a limited but an important tool. And from there, went to med school and residency in psychiatry. And it was after residency that shortly thereafter, an oncology nurse from Mass General came to me and said that she had just been diagnosed with pancreatic cancer and wanted my help discussing this prognosis and diagnosis with her son. So I did that. And then she took off for a healing center, and she started writing me and calling saying she was getting better. She was feeling a lot better. She was able to eat steak and salad again and had a lot more energy. She could exercise. She brought her children down to this healing center. And she asked me, since I have this dual training in medicine and theology, to look into what was going on. And I declined because I didn't think there was anything likely that couldn't be explained by traditional medical interpretation. But Nikki was great. She began having people call me from around the country and elsewhere saying they had these amazing stories of recovery. Did I want to hear their stories? And I said no. I was busy. But long and short of it is, in 2003, I did begin to look into the medical evidence for these recoveries, and it's been a life-changing journey since then.
Yeah, it's amazing. And it's a huge industry, actually, with people who haven't felt like they've gotten assistance from allopathic medicine, traditional medicine, and they go to faith healers, and they go to all types of alternative medicine approaches. I myself, we've chatted. When I had Hodgkin's lymphoma, I saw a clinical hypnotherapist who is teaching me to sleep and lower my anxiety and rest and helping me to visualize my body accepting the chemo. And honestly, I had a very smooth recovery, and knock wood, it's many years later, I'm told I'm cured. But that was very alternative, I think, still.
Well, and I think that was very intuitive on your part and wise. I think this research with gathering medical evidence from people who have these amazing recoveries has drawn me slowly into a really different world and caused me to see everything so differently. And it's amazing how long it took me to begin seeing this. But in retrospect, I realize now, as a physician, I was taught to make a diagnosis and start a medication, and that's it. We don't ask how people heal by and large, and that's slowly starting to change, but we're in the very earliest stages of even beginning to ask those kinds of questions about healing or well-being. So that's shocking. Most of the illnesses from which people suffer, we used to think that if we can map the genome and get the genes figured out, then we would have all these healing treatments. Well, it turns out it doesn't work that way for almost all the diseases. Most of the illnesses have a genetic basis, but genes get turned on and off by lifestyle and by choices we make, by nutrition, by all kinds of things. And so it's really lifestyle that is at the basis of 85% or more of the illnesses from which people suffer. And that includes all the major killers: heart disease, diabetes, lung disease, cancer, autoimmune illness. And so the fact that we treat these illnesses with medications and treat the symptoms, but don't help people treat the causes of our illnesses is shocking, the degree to which this occurs. And I'm very devoted to trying to help change the way we approach these problems.
Yeah, it's awesome. And as you're talking, I'm remembering I was told by my oncologist how important sleep was for my immune system, and that's one of the things that you have found was so critical. Can you share about the importance of sleep?
Yeah, sleep is huge. It's when our body rewires and restores itself. And so it's very common that when people are admitted to either the medical or the psychiatric hospital, they've not been sleeping well. And one of the first things we do is address sleep so the body can get better. The body wants to recover and wants to heal. And if we work on setting the conditions for that, well, then healing can occur much more easily.
Say that again, because for me, that's in a sense the essence of your book and your research. Is this, we have this amazing body that is wired to heal itself.
Yes.
Except we sabotage our bodies in so many ways from that organic process. So give us some more nuggets, and I'd love for you to share a story or two of people who had terminal, prognoses, nothing they could do, 6 months to live, and they're cancer-free, and it's 20 years later.
Yes. So, and that's, yes, absolutely. And again, it's so true that our body wants to heal. And if we will just focus on setting the conditions so that it can heal, then so many of these illnesses can have a very different trajectory, and suffering can be decreased and well-being can be improved. I can tell you a funny story about this whole issue that is, as medical doctors, we are not taught to even ask questions to help people heal. Jill Bolte Taylor, I think I mentioned to you the other day, she's this neuroscientist who was working at McLean where I work. She was working at McLean years before I was here, back in the mid-90s. And she was a neuroscientist who had a stroke. This stroke took out most of her left brain, and that's devastating, of course. When she and I met, she said, "I've been waiting for you for 22 years. She said, in 22 years, not a single doctor has ever asked how I had a full recovery from my stroke. Now, that's astonishing because she's a neuroscientist who had a stroke. She had the first TED Talk that went viral. It's been viewed millions and millions of times. She has this famous book that's in something like 30 languages and has been a perennial bestseller called Stroke of Insight. Oprah was doing a movie on her life until a couple of years ago, and Jill was named by Time Magazine as one of the most important people of 2008. You'd think as doctors we'd be all over this. This would be a really good person to study and understand. But she said doctors aren't interested. And so that's an anecdote of how big of a problem we have. I've been studying these people now for 19 years, and not a single person has ever had their doctor get interested in how they got better. The good doctors say, well, whatever you're doing, keep doing it because it's working. But they're not curious. And that's just astonishing. So I think we do need a paradigm change where we begin to help people understand the roots of their illnesses and how to begin healing these things.
Yeah, and I remember watching her TED Talk when it came out and how fascinating it was for me. I'm naturally curious, by the way, anyway, so I'm always poking people with questions. But I was fascinated by hearing a neuroscientist analyze her own subjective experience.
Yeah, isn't that fascinating?
Yes.
She does the same things in her recovery that the people I study tend to do. So it's the same. You see these patterns over and over and over across a wide spectrum of illnesses. And these are important stories for us to understand.
Yeah, and one thing I appreciated is that you have one foot firmly in science and grounded, but you have that curious kind of seeker, part of your spiritual journey thing, seeker, like what's going on here that isn't explained by normal mechanisms? And you cover a lot of important topics. We won't have time, so I want people to buy your book. And by the way, I listen to it, and I love listening to authors read their own books, but I also love having a book to review and remind myself. I'd like you to share one or two more stories about someone with. Oh, I wanted to say your method was you didn't want you only studied people who had documented medical problems, not just people saying I had cancer, but they really had all the tests, etc. You describe your criteria for the people you included in your study, please.
Yes, and that's important, and I appreciate you asking about it, because this was as rigorous as I could possibly make it. It was not only a professional journey, but also a very personal journey. Having grown up in a violent, confusing household and trying to figure out what was true, religion was often used as a way to coerce or control, or enforce obedience. So I
have to add corporal punishment, because you told me about the club that your father used.
Yes, well, that's right. Well, and just let me put a little parenthesis in about that. I mean,
please,
to just help understand how much trauma or violence can impact us, because many people have histories of physical, emotional, or sexual abuse, but not everyone does. And it doesn't mean that a person hasn't suffered trauma if they don't have those three kinds of histories. But the developmental trauma of the drip of learning false beliefs about one's value, about one's goodness, about one's the special nature that they bring into the world. If one has false beliefs about their value, that is its own kind of developmental trauma that plays a huge role in the kinds of issues that eventuate in the mind or the body down the road.
Yeah, and I just want to comment for my listeners, because I have a lot of former cult members as well as therapists who work with folks. It sounds to me like your parents left a cultish community, but they still carried all the indoctrination and all of the fear and phobia, and the body is evil, and you need to just be blind, absolutely obedient to your authority figures. So they kind of took that cultish upbringing, and you were subjected to that, you and your siblings, it sounds like.
Yeah, I think that's true. And I know you get into a lot of these things, and I appreciate the modules that you've put together around all of this. It's been life-changing for my partner and I to review these modules and begin understanding in a way that goes far beyond traditional psychotherapy, but deep into what are the factors that really do inhibit or control or shut down a mind and a body, and cause one to grow up believing that anger or that feelings are not okay, or to not know how to set up boundaries that are respectful of human life, or even to understand what human rights are for oneself or others in a way that's visceral and that one really gets. So if one's raised around compliance, or the one who has the biggest stick wins, you end up with a moral barometer that's upside down in some ways, because you're responding to situations morally more around compliance and obedience than really understanding human rights or having empathy for oneself or others in situations where morality or understanding of human rights is indicated.
Yeah, and I'll add another personal thing that you share with me was that at 18, because you were rebelling and asking questions, you were excommunicated.
That's right.
And a whole lot of my people were in the Jehovah's Witnesses or the Mormons or any number of closed organizations where they excommunicate, and there's a whole battery of trauma from being shut down and kicked out.
I think that shunning and excommunication are some of the really most difficult traumas for the human soul to endure. I think we are all wired for affiliation. We all want and need connection with each other. We know what happens to babies who are ignored or don't have a connection with a parental figure or caretaker. They shrivel. basically,
Right.
and even die. And, in connection with what we've been walking into, this really big subject, there's a book you recommended to me recently, Cooperson's book about children in the Holocaust.
The Holocaust Dilemma, I believe it is.
Yeah, that's right. And it's just it talks about some brilliant research. Back in World War II in Nazi Germany, the difference between the less than 0.5% of Germans who protected the Jews, for example, the difference between that group of people and the vast majority of Germans who then became Nazis and participated at some level in the extermination of Jews, the biggest finding in the research between those two different groups was whether the children had been raised with corporal punishment or not. So that's actually astonishing the more one walks into that. So the less than 0.5% of children who grew up and then protected or hid Jews were raised not so much with corporal punishment as much as with parents who sat down and explained the difference between right and wrong, helped them develop empathy for others, and helped them understand what it means to be human and that people matter. That's really different than growing up in a culture or a family where the person with the big stick matters and the situation is not so much about human rights or empathy, it's about compliance and obedience. That's a really different worldview.
Totally. And I'll just add, I misspoke. It's not the Holocaust Dilemma. It's the Holocaust Lessons. And I've done some interviews with David Cooperson on my blog on freedomofmind.com. But I also just want to, I don't want to miss the opportunity to plug my course for clinicians and others. A foundational course, which you were referring to modules that you were looking at, just for my listeners and people who aren't aware, that I just put this up on my website for people to learn from, and it's really showing me that it's really useful to even watch it with a partner and discuss things, because so many people are partnered with someone who had an upbringing like the one you were describing, but never really talked about it.
Well,
and the
yes,
need to support.
That's right. And so what we have found really useful is my partner's in California right now, and I'm here in Boston, but we can do the teaching on Zoom. We can do each of the modules, but then we pause and talk about many of the points. And so we're very slow at getting through the modules, but it initiates really important conversations that and raises questions we hadn't addressed before.
Yeah, please.
Yeah, I should also say as a psychiatrist that this is important not only for the average person on the streets, lay people, it's also important for clinicians. I'm a psychiatrist who I've provided therapy for years to patients. I also have sought psychotherapy myself for the past. And I will say there's an important piece that professionals need and that lay people need around just pure psychoeducation around what it means to understand the nature of coercively controlling relationships or relationships with undue influence and what it means to leave those. That's a very specific and critical kind of knowledge that most therapists and psychiatrists don't get any training in. And so the psychoeducation, which just helps people understand the framework that's critical for gaining great insights, can save years of therapy that's less directive. It's just really important that one understands how this works and what it takes to leave these relationships and to develop enough self-respect and understanding of one's value that you can develop a different kind of life.
Yeah, and I'm so glad that you pause and think about it and discuss it. That makes me so happy, because for me, the goal is to empower people to think and process their own experiences and connect dots where they may not have thought, I had a friend who was in a multi-level marketing group. Oh, that's the themes extend. Back to your work, because seriously, this is about your book and your great work. So please give us another story. I remember pancreatic stage 4 cancer. Share a story or two with people who had phenomenal recoveries.
Well, and I started Cured Off with a story about stage 4 pancreatic metastatic cancer. And I chose to start off with Claire's story because, to me, she encapsulated so many of the lessons that I'd learned from these amazing people I've been studying for 19 years. And she's kind of this every woman kind of person. She values science, but also believes faith is important. She normally was somebody who did what doctors suggested that she do, but she also thinks for herself, and so she held together many of the complicated aspects of what these recoveries look like, and she has a website where people can go deeper into this for themselves, because there's no way in one book or in one story I can begin to capture the universe of what each person is. So Claire's the story I started off with, and yes, she had in 2008 was diagnosed by biopsy with pancreatic adenocarcinoma, which is the worst form of pancreatic cancer. And pancreatic cancer is a death sentence by and large. It's radiation and chemotherapy typically don't do much except maybe extend life for a few months. Pancreatic cancer usually has a brutal, painful end that's quick. So, and again, this was kind of an empirical theology for me, because I was trying to figure out, how do we know what's true? So I only studied people. You asked what the criteria were earlier. So the 3 criteria I had were, number 1, the person had to have a genuinely incurable illness, according to all that we currently understand. Number 2, medically indisputable evidence for accurate diagnosis and clear evidence for recovery. And then number 3, no experimental medication or anything else that could potentially explain how they got better. And so, like everyone else I studied, Claire fit those criteria. And so once I had those medical data assembled and knew that her diagnosis had been accurate, and we knew what she was dealing with, then I interviewed her many times and went deep into her life to understand how she'd gotten better. So 2008, diagnosed by biopsy, and then in 2000, she expected to be dead within a year, like they told her. She prepared to die. But then in 2013, she had an abdominal CT for unrelated reasons, and the cancer was gone. So her doctors assumed it must have been the wrong diagnosis, so they convened a case conference and went back and looked at her biopsy slides, and the diagnosis had been accurate. Then my job was to begin looking back and reverse engineering, in a sense, to figure out how we can understand what's relevant for others. So what Claire did is what many people did. She prepared to die, and she began to clean up her life because she wanted to die well. She decided she didn't want to get the chemotherapy or radiation, because doing so would only extend her life for a few months at best and leave. And she thought she'd rather spend the last months of her life with people she loved rather than sitting in dark doctor's offices with other patients who were dying of cancer. And so she wanted to focus the time she had left with sharing love with others. So, and she didn't get surgery either. Surgery was offered, but she read online about the effects of the Whipple surgery, and it's a complicated surgery that takes out a number of body parts or parts of body parts and leave you typically with a lot of digestive problems and pain and things. And she decided she didn't want to live with those kinds of effects or side effects. So for her, even though, again, she values science, she decided that wasn't the path for her. She began cleaning up her nutrition. She began to get rid of a lot of the sugar, a lot of the refined flours that are so inflammatory for the body. It's important to understand that that many of the foods we eat in the Western diet are inflammatory. Cancer is an inflammatory disease. It's a disease of chronic inflammation. All of our specialization in body parts all these years has prevented us from seeing that chronic inflammation is the underlying common pathway in most of the illnesses from which people suffer. So cancer, heart disease, diabetes, lung disease, autoimmune illnesses, these are diseases of chronic inflammation, which means the immune system, which is what keeps the body healthy, not just from infections, but also from all kinds of illnesses. The body, these are all also autoimmune illnesses because the chronic inflammation causes the body to turn against itself, and the immune system attacks the body instead of the cancer cells or instead of the infection, etc. So she began cleaning up her nutrition and began learning what genuine nutrition is. That's a big topic in itself, and a lot of confusion out there. Doctors and even nutritionists and nurses get a lot of miseducation about what genuine nutrition is. We can talk about why that is, but I was given a very brief introduction to nutrition in med school, and it was completely wrong and upside down. So completely. Right. So she began to clean up her nutrition, also began to address her stress response, realized that she was living in fight or flight. She had a lot of unresolved issues in some relationships that mattered a lot to her, where she'd felt criticized for many years growing up, and began to work on healing her own inner world around those relationships because she wanted to finish well. Learned more about what forgiveness is, more about what that means to truly forgive, and not in a spiritually bypassing way, but in a way that really liberates oneself to feel free again.
Can you explain spiritual bypassing? Because it's a relatively new concept for me. I've been reading Dr. Lissa Rankin's book, and she talks a lot about spiritual bypassing. I'm going to be interviewing her in a few weeks, so I'm excited about that.
Yeah, and she's really eloquent about these things and talks very clearly about how we can use religion or spirituality to soothe and to achieve peace, but we can also use it in a way that also hurts us or limits us, because when we use religion or spirituality to bypass the reality of our lives or the traumas of our lives or the challenges and difficulties we have, it can make things more difficult for us, whether that's in facing past traumas in our own individual lives, or the traumas associated with racism or bigotry in our culture. When we use religion or spirituality as an anesthesia or as a way to numb ourselves instead of as a way to make genuine contact with ourselves and others so that our love can be more deep and more real, those are sometimes really different pathways.
And I'll just say that one point of connection between your work and her work and my work is we all are starting with a belief system that we are embodied minds. So our body, because I talked about dissociation and mind control, where we're not connected to listening to our bodies. And frankly, a ton of people in cults have all kinds of autoimmune illnesses where their body is saying, this is not okay, you need to sleep more.
Well, yes, that's right. And, Gabor Mate is beautiful on this. He's a great writer, and his book, The Myth of Normal, came out recently, and I
love that book, and I've asked him for an interview too. He said in the next year. So anyway, please.
Right, he's very busy right now, for sure. Right, but he says if you don't know how to say no, your body will eventually say no for you. And I think what's true is, as I study these, if I have studied these people for so many years, the thing that comes up over and over and over again is that so many people spend much of their life energy taking care of everyone else except for themselves, and don't know how to say no to the perceived expectations or perceived needs of others in a way that allows them to also focus on their own needs, their own well-being, their own right to an authentic life as a human being, or don't know how to say yes to the dignity and value they bring into the world. And I believe, frankly, after years of being both medical director at a psychiatric hospital, McLean, but also the chief of behavioral medicine at a large urban medical center in the Boston area, a Good Samaritan, that our medical and psychiatric hospitals and clinics are full of people who don't know how to say no, and so their body is saying no for them. Mm-hmm. And we need, those of us who work in the healthcare field, we have a moral obligation to help people begin listening to the messages that their minds and bodies are sending to them. And we don't do that typically.
Yep. And, speaking as a clinician for a minute, it's about understanding healthy boundaries.
Yes.
And when I first got out of the Moonies, I was thinking about going back to college because I was told to drop out, but I still was carrying around the Moonies ideology that it was selfish to think about me going back to college instead of who was I before the Moonies? I wanted to graduate college and go to graduate school, etc. But the whole notion of it's selfish to think of improving yourself or taking care of your body.
Yes, that dynamic I've seen over and over and over again in the people that I study. And I see that in a way that's not working for the people I see in the medical and psychiatric hospital, where those not asking those questions and not knowing that it's okay to invest in yourself, like go to college, coming out of a cult like you did. This comes out in so many different ways. And just to help walk around just how big of a deal this is, when a person is diagnosed with cancer, they often are, of course, terrified, but you'd be surprised how often at another level the person also has a response like, oh, if I've only got 6 months to live, I guess I don't need to take over the family business like Dad's putting pressure on me to do, or I don't need to go to law school just because Mom did or Grandma did or Grandpa. And I think there's a very insidious thing where too many of us are living lives that are not the authentic lives that are our own, but we're responding to others. And so when a person is diagnosed with cancer and they decide, well, I'm not going to take over the family business then, and when they start to live a more authentic life, that's sometimes really surprising when time begins to go by. I took care of this woman who had breast cancer once, and she healed from the breast cancer. And I suspect, after seeing this pattern over and over again, that one reason why she got better, or the main reason, is that she went from being this meek, lovely, very pleasant, quiet, self-effacing woman to this rather saucy, racy, I'm going to tell you what I really think, a little bit profane. I think her husband loved her, but he was pretty rough on her verbally, I think. And so she went from this more passive or compliant, more type of personality that tries to please others into someone who just simply was going to be more comfortable taking up space in the world and telling you what she really thought or felt. Yep. And I am convinced that shift was massively important in her own recovery. So now I help people set up selfish bitch projects.
That's funny.
Because initially people think, well, that's selfish to do that. No, it's not selfish. You're investing in yourself,
Exactly. That's the reframe. It's, research and development for your life to, live your best life.
Yeah. It's really a big deal.
It's really true. I'm going to push you a little bit, if I may, to talk about healers. I know that you've talked about placebo effect and nocebo effect and the 4-minute mile that nobody could break, and then everybody was breaking it. It was fast. Talk about some of the things you learned about healers and what the elements of that.
Well, yeah. And so healers tend to be characters. They're complicated individuals. They're human beings like the rest of us. I think it's important to understand that healing doesn't come from a healer. Healing comes from activating what's within all of us. And I think
say that again, because I think that's so important.
Yeah,
just repeat that.
Yeah, healing doesn't come from a healer, whether it's a physician or a spiritual healer or a guru. Healing comes from within us because we all have everything that it takes for healing. It's like when you plant a garden, you want to make sure you set the conditions of the garden so the seeds can grow in the best, most flourishing way. We are like those seeds. We have everything within us that we need, and we need to find ways to create the right conditions. What a healer does is activate what's within us. And I think it's important to understand that they are human beings like the rest of us. They often have a special wound that caused them to pursue the path of healing that they did that's related to their own history. And they can be very gifted in the same way that a scientist or a musician or a great writer can be gifted. Their gift is in the area of facilitating healing. But we have to realize that just because they are healers doesn't mean they aren't human beings like the rest of us with the same foibles or challenges. Unlimited power is dangerous for any human being, and that's true for healers also. And so they need accountability. There's been a lot of reports in the church literature, the religious literature, and the spiritual communities of the amount of sexual abuse that's slowly coming out that's been covered up for decades. So now but some of these folks actually get involved with faith healing. They experience a diminution of pain or whatever. I actually saw a UK entertainer, Darren Brown, do a Broadway show saying, I'm an atheist. I don't believe in mystical stuff, but here's how faith healers work. And he'd call people up on the stage who had all these medical problems, and he'd fix them through basically, in my opinion, hypnotic suggestion and the power of the situation, people's desire to get rid of the belief that I'm going to have back pain forever, or, I'm going to always have stomach digestion problems. And the healer can be a bad person or do abuse, as you were just alluding to, but it doesn't mean that the results aren't real. That's right. The mind is so powerful. And hypnosis is a good example of that, because hypnosis is in part a kind of deep relaxation that allows the defenses to be laid aside so that our inhibitory thoughts don't get in the way of the healing. And so that relaxing of the defenses does allow healing to occur. And it's shocking how powerful the mind is. Absolutely true.
So I want to just really get this message out to whoever's listening to this, that this is a real phenomenon. People can get terminal diagnoses and the terminal cancer is gone through love, practice, spiritual practice, stopping the sugar and the refined foods, sleeping 7 to 9 hours, getting rid of toxic relationships, and really believing in the power of your body, which doesn't mean if you don't heal yourself, that there's something wrong with you,
That's
or
right.
you have sin that you haven't admitted. That's where I really am upset with the law of attraction and all of that. That says, you created this disease, so you should uncreate it.
Right.
That's way dangerous and toxic.
Yeah, and a misunderstanding of quantum physics, right? I mean, that's a bigger discussion than we have time for, but the quantum physicists don't agree with how the law of attraction has been drawn out. It's true that the mind is so much more important than our models understand, but it's also true that quantum physics, the worldview of that, which is not a theory, it's an indisputable fact that's been proven thousands of times in these experiments, but still the law of attraction is not quantum physics, and physicists do not subscribe to that. So there's a lot to be said about that for another time, but it's a different
beware
thing.
Law. Because
Right.
that's one of Lifton's sacred science, where they make it's the truth with a capital T, as if it was. And let's share a few more tips. If my listeners have a chronic illness, we're not telling them not to see their doctor. I mean,
Right.
I got my biopsy, I had surgery and 3 months of chemo, and I had radiation, but I did all these other things. And part of the deal in my own mind was I'm going to work less hard, travel less, take Wednesdays off. So I'm going to have healthier boundaries. But share some more things, please.
Well, so that's really important, because I think you were listening to the messages of the illness. What is the illness trying to tell you that was out of harmony or out of balance in your life? And I think if we can help people do that, I don't want to say in any way that we can think ourselves into health, because it's not true. I do believe, however, and this is there's some really complex things to understand around this. I do believe that there is something in the deeper soul or in the deeper self of all of us that does not rest until it experiences unconditional love. We grow up on the playgrounds and we grow up in our families. We pick up beliefs, some of which are true, some of which are false. We continue to pick up these beliefs as we grow up in work situations, in school, with partners. And it's my belief that that if we have a mixed set of beliefs that we are carrying through the world, some of which are true, some of which are false, some are conscious, some are unconscious, well, then we're going to have a mixed set of results in our lives, in our minds and bodies and lives.
Conflict too, in many cases, right?
Oh, absolutely true. And so the more we can begin to heal false beliefs and experience our value more unreservedly, and find a way to experience unconditional love, and that has to ultimately come from within. But love is real, but again, we also set up a lot of conscious or unconscious fences that prevent us from experiencing that fully, and right. So it's a big topic, but a critical one.
Yep. People laugh at me, but I say love is stronger than mind control, and tune into your authentic self. And people are like, what's that? And I'm like, I don't know. All I know is I really believe that each baby is born with a unique part of the divine. However you want to define it, that's beyond space and time, and that responds to unconditional love. And a lot of my more advanced training in the last 10 years was around treating attachment disorder. My teacher, Daniel Brown, who wrote a textbook actually on attachment repair in adults and was my teacher, talks about asking people to basically go into an altered state, go back to childhood traumas, and actually imagine the ideal mother and the ideal father uniquely suited to me, and how would I have wanted them to treat me or act. And people can immediately come up with, I would want them to hug me. I would want them to tell me I had a nightmare. I'm okay. I would want them to say, you're special as you are. I love you no matter what. But so many of us walk around feeling we're not good enough.
Yes.
We need to have more fame. We need to have more money. We need to have a certain car or whatever to be loved. And it's just not true.
It's not true.
And sometimes less is more.
Less is more. I think you're right. I think that from childhood on, there's something in us that every time we walk into a room or meet another person, there's a part of us that's scanning for how much we feel seen and valued. And there's something in us that doesn't rest until we experience the unconditional aspect of that.
Yeah, and I'll just say the obverse. In cults, it's always performative love. We'll love you if you obey us and do our rules. And the minute you ask a question or challenge, you're out.
That's right.
All right, you're abused. And we need more authentic love and less judgment, more curiosity, maybe, to be interested in each other as human beings. This is such a unique journey that we get to be on as humans.
Well, and that's what you're saying is really relevant in today's culture where there's so much polarization. Polarization by definition is partial falsification, and at least partial falsification. And so there's both sides have some falsifications and some misunderstandings of others. And there's a way in which people are being treated as if some people matter more than others, some people matter less, and that stuff does a number to the psyche, and it's a real problem.
Yep, indeed. So we're going to wrap up in the next few minutes, but cured. And I really want people to understand if you have a diagnosis of cancer or Crohn's or any number of autoimmune things, check this book out and really think about what you can change in your life that may lower the stress, right? Because I think it's cortisol that it's good in short bursts, but chronically, it undermines the immune system. Share a little bit more about your research.
Stress hormones like cortisol, norepinephrine, adrenaline. So much of our life in modern culture, it's not so much that a bear appears occasionally on the horizon and then our stress hormones spike. It's that our stress hormones are spiked much of the time, way too much of the time. We sit in rush hour trying to get to work, and we have a lot of stresses that impinge on our capacity to raise children or take care of aging parents when our lives are so much more fragmented than they used to be. So the neurophysiology of resting your beautiful immune cells and the other cells in your body in a bath of cortisol, norepinephrine, or stress hormones is just a really different chemical environment than when your beautiful cells are resting in an environment of oxytocin, which is the love molecule, or dopamine, the pleasure pathway, and purpose pathway, or serotonin, the antidepressant pathway. So those chemicals provide such a different neurochemical bath, and the cells just respond very differently. If they are in fight or flight with being bathed constantly in stress hormones, we know on the basis of clinical experience and laboratory data that the cells begin to misfire. They begin to go after the target. They miss the target and go after the body instead. That's autoimmune illness. And the cells get confused. And so, and they get sluggish or they die early. And so getting into a parasympathetic state, which is the condition where healing occurs, is a very different chemical environment.
Yes, so please explain, we're wrapping up, but please explain to my listeners the sympathetic and the parasympathetic. And I think you named a really important thing about the parasympathetic is what we need more of.
Yes. So when we are in fight or flight, when it's like our physiology is registering that a bear is chasing us all the time and not just once in a while, that we're always under stress, that's the sympathetic release. That's the sympathetic nervous system. That is the release of all these stress hormones. When we are in a parasympathetic state, the parasympathetic state is with these other more healing hormones where the cells wake up and the beautiful immune cells begin to function correctly and crisply and efficiently. That's very different. When we smile, or when our eyes light up and make eye contact with each other, that's the parasympathetic pathway called the vagus nerve. The vagus nerve is the superhighway of the parasympathetic nervous system, connects with all the major bodily organs. But a smile or our eyes brightening as we make genuine and authentic eye contact with each other, that activates the parasympathetic nervous system and deactivates important aspects of the sympathetic nervous system. So whether it's with a loved one or just with a checkout person at the counter, making genuine eye contact and a genuine heartfelt smile is a way to begin activating the neurochemistry that our body needs to heal.
Yeah, and I want to compliment you. You have great eye contact and you smile, and I love your laugh.
Oh, thank you.
Your laugh is awesome. And really, folks, if you're online for 7 to 9 hours a day listening to horrible things that are happening all over the world, this is not activating your immune system. It's the other side, right?
That's right. And that is very true. And studies show that people who just listen to the news all day long, which the mantra of what gets on the news is, if it bleeds, it leads. So that's what's getting on the news. It's not reporting about all the positive, wonderful things that are going on. The world is getting better, actually. And this science is very clear on that. But if it bleeds, it leads is what drives the news. And we know that puts people into a more stressful neurophysiology that shuts down pathways of healing.
Yep. And the frame, we have beliefs that create the frame for our experience. If we have a grateful frame, we're thinking about all the parts of our body that are working.
Yes.
And all the loving people in our life. And when we have a frame where we're depressed or anxious or whatever, we're just paying attention to all the negative things.
Yes.
This isn't working, that isn't working. And so just understanding it's your mind and you can control it.
Yeah.
And you can literally do some deep breathing and enter the parasympathetic system. You don't need to go to some special retreat in Costa Rica, although it would be great and warmer than Boston right now. But you can really remember, if you've been to a beautiful tropical place, you can close your eyes and remember the feeling and the smell of the salt water, etc. And give yourself a moment, an island of relaxation and recharging your immune system.
That's absolutely true. We do become what we focus on. And for example, if you want to help a person struggling with alcoholism or diabetes, helping a person get a life where they know their value and have a life with purpose and meaning goes a lot further than just telling a person to stop eating the wrong foods or to stop drinking. We do become what we focus on.
Yep. And as we wrap up, Dr. Jeff, Cured, what I do want to also caution our listeners, it's another point you make, I believe, in your book, that everyone needs to be responsible for their own mind and body.
Yeah. And
you may have a loved one that you might try to force to read this book. My recommendation is read it yourself and then share the learning for yourself and see if you can pique their curiosity rather than stop eating sugar or you need to sleep more. That's not going to help people, take care of themselves, right?
Well, it's the same kind of thing as what you do when you help people leave coercively controlling relationships or cults, right? You want to help a person feel loved and valued, and you want them to think for themselves. You're not trying to control a person into doing what you think they need to do. I think there are deep decisions that only the soul knows and can even be different than what a person consciously thinks they believe that will guide their actions. And so we have to be very respectful of each individual autonomy and their ability to think for themselves.
Yeah, and I'm going to wrap up now. Forgive me, we could talk forever. But I've been telling people with the cult of Trump, which guilty, I wrote that book, but I've been saying, if you have a family member or friend who was believing Donald Trump is the Messiah and a great person, don't call them names. Don't try to just attack Trump or their beliefs, but be curious. Say, I care about you. I respect you. You're intelligent. Tell me more. Tell me when you decided you thought he was a good person, worthy of your respect, and how are you feeling about it now, but not an attack or I told you so, because a lot of people are leaving the cult of Trump now, honestly. They're not trumpeting it, but I'm really encouraging everyone to reach out to family and friends and just say, hey, I miss you. And if I offended you by calling you a name 3 years ago and blocking you on social media, forgive me. Let's do a restart, and I want to end with the body is amazing. And you've done something quite pioneering in this book to say, look, listen, people, what the current system is not working. We need a much more robust neuropsychosocial frame to enter into this healing space. And let's really believe that if we make the changes to help our immune systems, we can live a much more healthy and robust life.
That's
but you
really
get the last
message.
Words, Doc.
Well,
I've been talking too much.
Yeah, I think if we in the medical field and the psychiatric field can help people just begin to become curious about what their minds and bodies are trying to say to them, it would give us opportunities to really begin to decrease the amount of suffering that people have in their lives.
Yes, amen. And so nice to meet you, and thank you for your great work, and thank you for taking my course, and let's be in touch because I really want to learn from you. And I know you're interested in teaching more of your fellow physicians as well as the world about we can really change the trajectory of the quality of our lives.
Yes. Well, I appreciate the work you do also. This is important work, and we all have something we're meant to be doing, I think. So.
Yeah, that's true of me. Dr. Jeffrey Rediger, cured. Thank you so much.
Thank you.